Anxiety, symptoms, causes, how to calm it. Sweats, palpitations, sweaty palms, ruminations. Anxiety occurs for no apparent reason and its causes are not easy to determine. How to recognize it and learn to manage it. What are the differences with stress and anxiety? Explanations and advice from Carine Grzesiak, psychologist. Definition: what is anxiety? Anxiety is characterized by a diffuse feeling of unease of which we do not really know the origin. This feeling of latent danger is permanent, unlike the stress that occurs in specific circumstances. The anxiety can be real or imaginary, but the subject who suffers from it cannot tell the difference. Anxiety should not be confused with stress, it's not at all the same thing. Anxiety is much more diffuse, much more insidious. Stress occurs when you have a particular ordeal that can make it rise, but the subject will succeed in knowing what are the perimeter and the object of his stress. You have to imagine that the anxiety is a big sheet of fog. There are lots of things inside, often little bits of subjects, but it's a much more diffuse feeling, which we can't manage to circumscribe, comments Carine Grzesiak. What are the symptoms of anxiety? Originally, anxiety is physiological before being psychological. It is manifested by reactions at the level of the body, with in particular an acceleration of the heart rate, an increase in temperature, sweating, stomach aches or even panic attacks. This will send the message to the brain of imminent danger, whether real or completely imaginary. As a result, the brain will produce cortisol, the stress hormone, to cope with the danger. However, this overproduction of cortisol will lead to a deficit in well-being hormones endorphin, dopamine, serotonin, oxytocin, DHEA, which will have the consequence of making us see the world with dark glasses, explains the psychologist. In other words, there is first this physical disorder which is put in place before the emotional destabilization. Anxiety attack, panic attack. Symptoms and treatments: fear of dying, of losing control, of going crazy. An anxiety attack, or panic attack, is characterized by intense and uncontrolled fear. How to recognize it. What to do when it happens. Answers from Pierre-Michel Yarko, psychiatrist and head of service at Clermont-Ferrand University Hospital. What are the causes of anxiety? Before looking for the causes of anxiety, we think about how to get out of it. This feeling is so uncomfortable that the first thing to do is to recover the comfort of life, indicates Carine Grzesiak. Once we are less under the influence of anxiety, we will ask ourselves the question of how it is made up, why it exists, what feeds it. For example, if you have a mother who has had a hyper beware of you, who has brooded over you a lot and has always made sure that nothing happens to you, this completely unconsciously means that you would not be able to face or survive this type of danger. It develops anxiety. In the brain, there are several areas that have different functions. Some are more emotionally focused. Others, like the prefrontal cortex, focus on rational functions. When an individual finds himself under the influence of an emotion, it overheats in the center of the brain and it comes to bog down the connections between the emotional parts and the rational parts. In other words, functionally, it is not possible to rationalize a fear or an emotion, she continues. Nocturnal anxiety, the sign of what? The night is conducive to anxiety since it is often the time when we process the events and emotions of the day. The best way to calm her down and avoid insomnia is to practice cardiac coherence. It consists of breathing at a rate of 5 seconds on inspiration and 5 seconds on expiration, for 5 minutes. Anxiety or anxiety, what are the differences? Anguish and anxiety designate the same feeling and the same mechanism. Anxiety is simply the more pathological term. It is between stress and anxiety that there is a difference. Anxiety. How to fight it. Defined as a feeling of imminent danger of indeterminate origin, anxiety combines emotional, somatic, cognitive and behavioral symptoms. What are the causes? How does it manifest? How to overcome? Explanations and advice from Dr. Patrick Lemoine, psychiatrist. How to calm anxiety. The main drugs used in anxiety disorders are alprazolam Xanax, bromazepam Lexamol, oxazepam Seresta and prazepam Lisantia. Many natural alternatives exist, especially with plants such as griffonia, passion flower, valerian. At the same time, psychological follow-up is necessary to work on the causes of the anxiety. How to use homeopathy against stress and anxiety. Small homeopathy granules can be a great help against the effects of stress, anxiety, anguish and nervousness. Let's discover the products used and the dosages required. Our expert recommends the practice of cardiac coherence. The objective is to learn to regulate the heart rate, which increases considerably when there is a peak of anxiety, specifies the specialist. This technique should become automatic for all those with great anxiety. A patient who is regular in his cardiac coherence exercises will feel the benefits within 8 days, argues Carine Grzesiak. There are free, very well-made applications Respirolax, Respirotech which allow you to become familiar with cardiac coherence. Cardiac coherence. Breathing according to Rule 365. Cardiac coherence is a gentle method of relaxation. Based on breathing, it reduces stress by regulating heart rate. Benefits, exercises, methods. Here are the instructions. Meditation is more focused on the work of ruminating thoughts that feed anxiety. Physiologically, the benefits of meditation are real, but it's slower than cardiac coherence, nuances the psychologist. Often our thought patterns are shorter in anxiety. This is called a rumination loop that will freeze on a few ideas, on average 3. Anxieties set in and stop the pattern of thinking. After having calmed the cortisol with the cardiac coherence, place to the technique of the downward arrow, or the so what, to break the loop of rumination by giving it all the space to open.